My name's Ron Romanelli. I'm at the Orthopedic Center of Illinois, and I'm an orthopedic surgeon. Been here for 25 years. I became an orthopedic surgeon because of the passion for fixing things. I like to help people, and in medicine what I found is that you can't always help people when you're maintaining blood pressures or you're changing and treating diabetes and changing medications. And what I found with orthopedic surgery is I can take somebody's life and change it for them. They'll walk in, they're limping, they have pain, they have a lot of discomfort. We can eliminate that pain and we can make them better and change their life. I have a lot of challenging cases. Some of the ones that stand out that I probably am most proud about and memorable is the trauma 3.5-year-old boy slipped underneath his father's lawnmower and he cut his leg off, and the only thing really was attached was some skin. Cut his nerves, cut his bone, and the plastic surgeon and I wound up putting his leg back on, and so we transplanted his leg from really just a severe trauma, and everything healed. His bone healed, his nerves and arteries came back, and so it was a real blessing to see somebody like that be so traumatized at such a young age. And then now he's 22, and he's just kind of near and dear to my heart. The nice thing about him is we did his reconstruction, but then a year later we had to lengthen his leg up about 1.5 inches, so I had to learn a new technology, a new technique to be able to lengthen his leg, and so that was one of the good things about orthopedics is that as technology grows, we can do these things that are just so much nicer nowadays than they were in the past. And so it's something that's always a challenging field, being orthopedics, because of the improvements we have in medicine and technology in medicine. Probably the analogy between orthopedics and golf is that every hole is difficult, every patient's difficult, every challenging shot you have in golf, you'll have a challenging patient. Patients are challenging not only from the anatomy standpoint and trying to fix their disease process if people neglect themselves or they have bad deformities. So right now I'm in reconstructive surgery, and so I'll take a lot of shoulders, hips, and knees and then be able to restore their function through total joint replacements or osteotomies. So every golf is challenging and people are challenging on the anatomy, but sometimes people's personalities are challenging as well. They either don't want to be here or they're afraid to be here, and so we really try and make them feel comfortable at Orthopedic Center of Illinois. We try and cater to their needs, make them better, and it's always a pleasure for me to have somebody come in pain, have a lot of discomfort, a lot of disability, and they get to leave very, very happy. They get to leave with a stable hip, a stable knee, a shoulder, and their pain's eliminated. They go back to their normal lifestyle, and that's very rewarding for me. Of course, have to keep our surgical skills up just like we do our golf skills, and it's something I probably started at 39 years of age, and just love golf, but you always need to keep trying to achieve to get better in golf, and it's the same way in orthopedic surgery. I think we're all very talented orthopedic surgeons in this group, but every day is a new challenge, and I think you wind up trying to take that challenge on and do your best you can, and I think our outcomes and our results at the Orthopedic Center of Illinois are very, very good. And just like we're good golfers, we try and be excellent surgeons, and that is our passion. I think right now golf is leisure, where orthopedics is my life, and I think that we all have that and share that passion of treating people in the best ability, the best way we can, and to our best ability. We have 15 doctors here. We have 12 orthopedic surgeons. We have 2 specialists in physical medicine and rehabilitation who take care of the spine. They do cortisone injections into the back, treat people with neck and back problems, as well as ultrasound guided technology. And then we have 1 occupational medicine physician who will help the injured workers get back to their workplace. I feel that as soon as you step in Orthopedic Center of Illinois, our building is excellent. I think our building is a beautiful building. The people inside this building are great. We've grown from our initial building on 901 Jefferson when I started, which was a remodeled grocery store, and now I think we're just in a fantastic Frank Lloyd Wright design building. But our family has grown. We've really started with probably 40 employees, and we're over 100 employees right now. But everybody here, from the receptionist to the phone operators to all the physicians that have been chosen to be part of our group, we all get along very, very well. We all share this common passion for excellence. We all are the best in our field. I feel that we're cutting edge technology. Everybody stays up on their board examinations, on the current literature, on the state-of-the-art orthopedics, and I feel that our results are above everyone else in terms of our data that we look at and the research that we do. We really feel that our results are better. The patients, I think, can feel that when they come in the door, because the whole team here is really about the patient. So the nurses, the doctors, and everyone really caters to the patients. And so not only do you feel good via the environment, you feel good because of the people that are here and the surgeons that are taking care of you. We have all bases covered at Orthopedic Center of Illinois. We can take care of kids, we can take care of 90-year-old adults. We take care of trauma. We have every specialist and super specialist from hands, from neck to toe. We have 2 foot and ankle specialists. We have 3 orthopedic surgeons that really specialize in reconstructive surgery, total joint replacement, fixing up knees and hips. We have sports medicine. We have 2 sports medicine physicians who will take care of all sports medicine injuries. We have an orthopedic surgeon who's a non-operative orthopedic specialist who will see walk-ins and take care of whoever, whenever, and be able to treat them in a non-operative fashion. And if non-operative treatment fails, then they'll be able to be referred to one of the super specialists in terms of getting them fixed up. We have foot and ankle specialists, and so all the bases are covered at Orthopedic Center. We have somebody on call 24/7, so every time there's anybody that comes in, one of our patients or anybody that comes in for trauma, fractures in the emergency room, we're always available. One of the comments we always get from other referring physicians as well is, you guys are so easy to work with. So when somebody's in the doctor's office and they have a problem, we have a 1-800 number. They call our triage nurse. We get those patients in immediately. We find that that's a cutting edge over the other groups. Other groups don't necessarily want to work people in, so I think we really try and do a good job trying to take care of the customers and getting people in.